Hello, hello, it's Dr. Yates in Chicago. I want to talk to you about something very dear to my heart. This is a patient of mine, Shirley, and she's been kind enough to come in and let her and us use her post-op videos and pictures. So I want you to look at a picture, this picture here, and I want you to say yes or no, is this you?
Yes.
That's you, okay. Do you like what you see? I mean,
No.
the hair, other than that, I'm sure you like everything else.
Yes, I liked everything else, but I did not like my hair at the time.
Okay. And let's flip this around. I want you to take a look at that. And I've done the artwork for you, so I've drawn on it to show you how I've changed her hairline there, okay? So if we put these side by side, you can see that her old hairline started right about here, okay? So we kind of dropped her hairline about 2 inches, 3-4 centimeters or so. And we did it all the way around and kind of blended into this area here. Now, what Shirley has is something that's fairly typical. Like you saw a dermatologist, actually, a real fancy one. And what did your dermatologist say you had? Do you remember what she said?
A form of alopecia.
Right. She said the form of alopecia she had was two things. She had traction alopecia. That's what everyone refers to as the edges. So, right, the edges, and then she had scarring alopecia up here through the top, okay? So what we did a hair transplant, good hair from the back, gets moved to the front, and we mainly tackled this area of traction, okay? This area of scarring we've been treating with PRP, Rogaine, things like that, and it's actually limited the damage. No new hair has grown, but we've limited the damage. But this up here, I think, is a night and day transformation. And these are the kind of results we get all the time because we're experts at doing this. Has anybody said anything to you like, wow, Shirley, your hair looks good?
Yes, my husband, of course, and my beautician, she was amazed. She was waiting for me to get the process done and see what would happen, and she was amazed at the transformation, and I am too.
Is she going to send people here?
Yes.
Okay,
yes.
Good. Because, I mean, this is dear to my heart, because we see a lot of patients in the past that have, had treatments, this and that, a lot of snake oil treatments, and nothing seems to work. But we've kind of got this down now. I think using PRP, because you have to use something to optimize your results. And that's why we do the PRP with the surgery, because the PRP provides growth factors to allow the hair to grow better, the take to be better, and just look better. And I think it works miraculously when you combine PRP and traction alopecia. So I just wanted to show you, and Shirley, thank you for letting everybody see your results. Like, turn this way. Good. We pulled out the hairline into the temporal points here. This hair is beautiful back here. Beautiful donor hair. Turn this way. Same thing here. We've pulled this back, and she has lots of good density here. And now turn to the front, and it just gives her more options for styling. Like, look at all this hair here. Now with the frame of her face, she can do whatever she wants here. If she wants, she could put extensions back here to give more length. But if you don't have the frame of the face, what is there to talk about? Then you have to wear a wig or something up here. When I see people in public, my eyes go right here. I want to see the scalp. I want to see hair coming out of the scalp. If I don't see it, then we know what you have. So it's so important to have this. You can always work with this. So right now, I think you hit a home run. I think you look absolutely fabulous. It's only been 9 months, so you have a little bit more time. We're doing more PRP today because we believe in it. We've also talked about exosomes, which is something new, but you have to do something in my book to boost the growth, especially when you have, scarring alopecia and traction alopecia, okay? So I hope everybody understands what we do. We're in Chicago, so there's no excuse not to come here. And no, every hair transplant place is not created equal. Come see us in Chicago. Thank you.